In terms of symptoms in dry AMD, the early stages are asymptomatic, and gradually there is decreased vision due to waste products obscuring the path of the light. And advanced stages will present with scotomas in the central or pericentral regions. Remember that AMD is age-related macular degeneration. Macula is responsible for central vision. And scotoma is an area with diminished or entirely degenerated visual acuity. Wet AMD as a macular degeneration can also present with central scotoma. It can also present with something called metamorphopsia. This is warping and distortion of vision because of the fluid on the inside of the eye. There are specific signs that you may be able to observe in a patient with AMD. In dry AMD, the patient may have decreased visual acuity. When holding an Amsler grid in front of a patient, the description of the grid may be abnormal. So, to the patient with AMD, the grid may not be continuous throughout. There may be small localized areas where the vertical and the horizontal lines are not present. Upon observation of the fundus, you may be able to note small yellow spots or drusen. On the OCT, you will be able to note the atrophy or the thinning of the RPE layer, and the foveal reflex overall will be blunted. In wet AMD advanced stages, there can be choroidal neovascular membrane and lipid exudates. Subretinal or intraretinal fluids, including hemorrhages, can be noted upon fundus exam, and RPE tears even may be noted. Drusen is not a characteristic finding in AMD. As such, patients presenting with the symptoms and signs that we just discussed may have entirely different diseases, and thorough workup is required. The differential diagnoses commonly considered for AMD is dominant drusen and pattern dystrophy, which is caused by a buildup of lipofuscin, Best's disease, which is vitelliform macular dystrophy, Stargardt's disease, which is a hereditary macular dystrophy, drug toxicity with a lot of ocular side effects, central serous retinopathy, and angioid streaks and myopic degeneration. For a patient with potential AMD or risk factors for AMD, a complete ophthalmic history is warranted. This is either to confirm AMD or to rule out other important diseases of the eyes. This includes any ocular medications, ocular conditions the patient may already have, and family history, surgical history, and also general systemic medical conditions and medications are also important to note. Vision's pupil and pressure before starting any slit lamp exam, and also observe each layer of the eye from the anterior to the posterior segment with the slit lamp exam. Then you can dilate the eyes of the patient and perform a fundus exam. In terms of investigation, you can look into FA, fluorescein angiogram, on which the presence of drusen can be detected. Fundus autofluorescence can evaluate areas of geographic atrophy that looks dark, and on the OCT, You can also identify areas of drusen and atrophy of the retinal layers.